Hey guys, and welcome to another video. So without doubt, the question that I get asked the most is what's the difference between an osteopath, chiropractor and a physiotherapist? This is by patients I see every day and even kind of friends and family that still don't quite know the difference. So what I want to do here is just highlight some of the main differences. So we'll look at the training, the treatments, and then which one's best for you. So training. An osteopath will do a 4-year full-time course. It's now called an undergraduate integrated masters. So that means some of the modules, normally the dissertation, is done at master's level. This can also be studied 5 years part-time. You then have a chiropractic course, which again follows a similar pathway. So 4 years full-time, 5 years part-time. And then you have a physiotherapy degree. So this can be studied 3 years at undergraduate level, or you can do a 2-year masters, which is called a pre-registration masters, and it's an accelerated condensed course. You can do a osteopathy masters in the same format in the 2 years, which is what I actually did. So you have to have a relevant undergraduate degree. So in my case, sports rehabilitation, which then enabled me to do the 2-year masters in osteopathy. In terms of the training, so as an osteopath, we generally call ourselves holistic. So we like to consider the whole body when looking at a patient. This also encompasses what's called the biopsychosocial model. So I may go into that in a little bit more detail in other videos, but basically you're going to look at everything to do with that patient. So that might be their home situation, how much support they have, how much sleep, their nutrition, just looking at every aspect that may then impact on, yes, they're coming into you with a neck or a back pain, but there's so many different factors that then influence that. In terms of chiropractor's assessment and background, so their training teaches them that most issues arise from subluxations within the spine, which is why they're generally known to be more manipulation dominant. This isn't the case. Again, with every single practitioner, this is a little bit of a generalization in terms of my opinion on the different professions. So their treatment will tend to be manipulation focused with potentially some soft tissue in there. As an osteopath, it's very much of a mix between manipulation if it's indicated, or it may be soft tissue, exercise techniques, breathing techniques. It may be a few different things. It may be more soft tissue focused. We might not even manipulate the patient at all if it's not necessary. And then with a physiotherapist, their approach will be a lot more exercise based, particularly if it's on the NHS, so in the National Health System here in the UK. If it's in private practice, again, there's even more of a crossover. So particularly if they have a manipulation background, manipulation focus, we all can and we all do use exercise as part of our programming for our patients, but this will vary so much depending on the practitioner and the way they work. So you're having your first treatment with an osteopath. We tend to use anywhere between 45 minutes and 60 minutes for our initial consultation with the patient, and this generally does involve some hands-on treatment. It depends obviously on a case-by-case basis, but normally it would include some hands-on treatment. Follow-up can be anywhere between 30 minutes and 60 minutes, again, depending on the practitioner, depending on the patient that's in front of them, and how many different things they need to address within that one session. As a chiropractor, they tend to have shorter appointments, so the initial might be 30 minutes, and then the follow-up can be 5, 10, 15 minutes, just depending on the practitioner. And then with a physiotherapist, again on the NHS, they sometimes only get 20 minutes, maybe 30, depending on the NHS trust. And in private practice, it will be similar to an osteopath, so 45 to 60 minutes for the initial consultation, and then the follow-up will depend on what they need to treat or any exercise that they need to do as part of that session. So it could be between 30 and 60 minutes again. Okay, and now we're on to what's the best option for me, and it depends. So patients will message me and say, is osteopathy right for me? And sometimes yes, sometimes no. So I tend to get a bit more information about the injury or why they want to consult me in the first place. And sometimes me as an osteopath will be the best solution, but sometimes it might be a physio or a chiropractor, or it might even be a sports massage or maybe even acupuncture. It might be that they need to address other issues, maybe nutrition or weight, so it might be best to see a personal trainer or a dietitian or a nutritionist. So it very much depends, and I think, again, advice for therapists listening is if you're upfront and honest with your patient, that goes a long way. So just because they've approached you, they're going to pay you £100, don't just take their money because they've asked you to treat them. So in terms of obviously growing a business from that side of it, that patient will respect you more by being honest with them and telling them kind of the correct advice, if that's not to see you and not to give you any money. And so whilst you don't get paid from that patient, they're then going to tell friends and family, look, I went to see Nick, I spoke to him over the phone, by email, he said actually I'm not the best person for you, recommended me to XYZ therapist, and it was very honest and they like that. So if you're not the right person to see them, then let them know. Sometimes you might not know if you're the right therapist to see them and treat them until you've had that first session. So by all means do the assessment, do the consultation, and if you think it's out of your remit, it's not in your scope of practice, then again, just be honest to the patient and tell them that. Honesty goes a long way. And if you still don't know who to go and see, then I genuinely think an osteopath is a good place to start. So the way that I explain to a lot of my patients is that osteopathy is a mix of chiropractic and physiotherapy. So we use manipulation when it's indicated, and we also do soft tissue, so massage, and also any exercises, stretching, acupuncture potentially as an extra modality. So I think it's a good place to start. And in my opinion, an osteopath will always give you their professional and honest opinion. So if they think that you should go and see somebody else, then they may have a recommendation for a local therapist that's a chiropractor, physio, soft tissue massage therapist, and they can then pass you over to them. So I think to get their professional opinion is still definitely worthwhile. If after watching this video you're still a little bit unsure, obviously again you can always reach out to me, let me know if you have any particular questions or specific injuries that you want my opinion on. And the best way to contact me is by email, so nick@nickcastle.co.uk, or check out my website nickcastle.co.uk, and you can message me directly from there. Anyway, thanks very much for listening once again, and I look forward to speaking to you soon. Take care, guys.